I'm gonna take you back to my high school days in Biggs, California for just a second. So everybody go back, get the hair up, you know, get the old clothes out. And in the spring of my senior year, I had a counselor who pulled me into his office. And, you know, I gotta tell you, I was a little nervous, right? I go over there and I'm thinking to myself, man, I'm innocent. I didn't do anything here, Mr. Landry. You know, you never get called down to the office, right? And we didn't have texting back then, so I wasn't able to text my friends. So I went in, sat down, started a conversation with him. And he started to talk to me suddenly about the SAT. And I was like, man, what's he talking about? The SAT, what is that? And he kept talking to me more and he kept explaining. And finally he got to the point that it's a test and that, you know, I should take it. And the more he talked, the less convinced I was that I wanted to take this test, right? I was thinking to myself, okay, so this guy wants me to show up on a Saturday morning. He wants me to go somewhere to another school. He wants me to sit down for, you know, 3 or 4 hours. He wants me to take a test. And then on top of that, he wants me to pay for it. No, I was like, I'm done. See ya. I ain't doing that. But thank goodness he was pretty persistent, right? So he kept talking to me, and finally convinced me to go participate in the SAT. That morning, whenever that test took place, I just showed up, right? I got the free pencil. I, you know, got a few answers right, I hope. To this day, I have no clue how I did on the test. You know, I've never looked back. I have no idea who even paid for it, because I got to tell you, I wasn't going to pay for it, right? I had no money. So I think I still owe Mr. Landry the registration fee. But as I look back now, and as I kind of contextualize that experience, it was huge. It was huge. This man, by having me participate in the ACT, opened up a whole new door of opportunities for me. What I didn't understand then, that now looking back, I totally get, is the fact that the ACT was a gateway. It was a gateway for college acceptance, right? And for me and for the kids in my community, it was a major obstacle. Most kids in the neighborhood that I grew up in, you know, we didn't go to college. And if those few that did, the chosen ones, they went to the local JC. And the results were pretty predictable. They would go there for a semester or two, and then next thing you know, you'd be like, hey, what's up, man? What are you doing? Oh, man, I dropped out. And that was kind of the cycle, right? So for my counselor to suddenly open up this door for me was monumental for my future. As I look back, and as I think about this experience, it can be really instructive for us as educators about the type of culture we want to create in our schools. And that is a culture of care. Now, the bottom line, again, in my experience, was that this man was willing to take a chance on me, right? I came from a family of migrant workers. Here's a picture of my grandfather and some of my uncles working in the watermelon season. And I gotta tell you, Mr. Landry had every excuse to justify not giving me attention. I grew up in the labor camp, government subsidized housing. I certainly didn't give him any interest for him to give me attention. My parents were dirt poor. Here's a picture of three generations of Monteros working in the fields. That's my grandma over here on the left, and my dad down here, always working in the fields. They were totally disconnected from my education experience, and it wasn't by choice, it was by circumstance. So all this context I give you to show you that this man, Mr. Landry, he said, you know what? I'm still going to take a chance. I'm still going to take a chance on this kid. I'm still going to say, you know what? He can take the SAT. Now, as I have now, as a professional, have worked in both the East Coast, the West Coast, here in Utah, all over the state, and I compare my experience having gone through, the ESL programs and all of that, and I think to myself, I juxtapose what I grew up with and what I have now, and there's several patterns that surface. The first one is that what occurred to me happened in a pocket of isolated success. The school that I was a part of, the district that I was in, they didn't have systems to help kids like me. I had a man who took an interest in me and who said, you know what, I can make a difference, but yet it wasn't a systemic effort, right? So that has raised a lot of questions for me. I often wonder, can we truly have schools where every kid is cared for systematically, right? Can we have schools where the adults in the schools set the priority of the kids as the number one thing? Not their comfort levels, not their own idiosyncrasies, their own insecurities, but the needs of kids, right? Can we have schools where you can walk down the hallway, whether you're a freshman, a dysfunctional sophomore, a shy junior, and not be picked on and make actually connections? Can you go into the lunchroom and actually, have friends there, have connections? Can you go into your classroom, regardless of which teacher it is, and have that be a safe spot? Can you have a school, right, where the teachers are very deliberate about their high school experience? Look at that picture, right? Don't laugh. Senior year, right there, with some of my boys that I went to school with. I didn't think of these questions then. I think of them now. What happened to me back then was purely out of luck, right? The fact that I had this experience. And the last question, man, this mic. The last question that I have, right, is can this vision, these questions that I'm asking, can this actually happen in a secondary school of, 2,000 kids? Can we have this type of vision where the needs of kids come first? Can it happen in large comprehensive high schools? Or is it fool's gold, right? Are we simply too big, too institutionalized, too fragmented to be able to be deliberate, safe, and to prioritize the needs of kids? Well, I gotta tell you, if you're asking me that question, the answer is no. I think we're totally capable of providing that level of service and that type of service in the schools that we have. And the answer, in my opinion, is to do it through accountable care organizations. Now, Alta High School, where now I have the opportunity to be principal, is your prototypical high school, right? Large school, big student enrollment. If you look at our course catalog and you compare it to a catalog of a junior college, they would be very comparable. We have a phenomenal extracurricular activities, a wonderful athletics program. Go cheer for the Hawks tonight. We're playing Lone Peak in a few hours. So again, just your prototypical high school, right? And what we're trying to do at the very core is to become an accountable care organization. We're trying to have a transformation at the very core of our school, a cultural shift, right? Now, before I proceed and explain to you what an accountable care organization is and how it applies to us, I have to give credit to one of my intellectual heroes, Dr. Atul Gawande. A while back, I was hanging out with my brother-in-law who was training to become an emergency care doctor at Yale University, and he told me about Dr. Gawande. And he was reading a book by him titled Better, which is on the experience of residency for first-year medical or first-year residents. I picked up his stuff, and I got to tell you, it has impacted my thinking since then, and it continues to impact my thinking today. And some of his thinking and his ideas are peppered throughout my remarks. So, what is an accountable care organization? An accountable care organization is one that is congruent in its philosophy, systemic in its approach, and intentional about the things that they do. Okay? So I'm going to give you an illustration of what these things are. And I got to take you back a few years to when our country was having a debate about healthcare, right? And I guess in some ways we still are. But back in the 2006, 2007, Dr. Gawande wrote a fascinating article where he posted a question that was really interesting. And he asked, what is the most expensive healthcare market in the country? Right? The most expensive healthcare market in the country. But then in addition to that, he asked, why is it the most expensive healthcare market? So when I was first reading this article, man, I was thinking, Boston, Los Angeles, maybe San Francisco, maybe Florida. And then all of a sudden he gave you the answer. And it was McAllen, Texas, down here. And I chuckled. I was like, dang, I knew everything was big in Texas, but even, their healthcare market is pretty pricey as well. What was interesting about McAllen, Texas is that when it was compared to similar cities that had similar demographics, similar regional, locations, similar populations, the cost of healthcare in McAllen was still way, way higher than in other places. And what was interesting, what complicated this whole debate, was that just because people were paying more in McAllen, it didn't necessarily transfer to better services. It was just more expensive, right? I bring up this example because McAllen can be very instructive in understanding what an accountable care organization is. And the reason why is because it is the opposite. What was happening there was the opposite of an accountable care organization. It's the best non-example. So you're probably wondering, okay, Fidel, what was happening there, right? What was interesting when Dr. Gawande looked at what was happening in McAllen, he discovered some interesting patterns that were really, for the people that were there, they could not see this at all. And it was really quite simple. It was an overuse of medicine. Overuse of medicine, and then a lack of collaboration, a lack of systems, a lack of congruency, a lack of unity among those people that were working in their healthcare industry. So for example, if you had diabetes and you needed a couple of physicians to manage your condition, you could go to one, get treated, and then go to the other, and they would never talk to each other. You could have the same test done 2 or 3 times at a very expensive cost, and yet there was no deliberate action between these physicians. Now, in contrast to what was happening in McAllen, something really cool was happening and it's continuing to happen today in the Mayo Clinic networks. The Mayo Clinic networks, they start out with one premise, and that is that the needs of patients come first. So think about that for just a second. The needs of patients come first. When people go see a doctor in their network, the interest of the doctors is not first. It's not the interest of the networks. It's not the administrator. It's not the profits. It is the absolute needs of these patients, right? When they go see a doctor in this network of providers. So when you go in there and you get treated by them, they work in collaborative teams. So the doctors will sit down and they'll say, okay, what's happening with this patient? Not only the doctors, but they also bring in the nurse, the physician's assistants, even the janitors will sit down at the table. They all hang their idiosyncrasies and their pride on the closet, and they say, okay, what can we do to make our service better? They're absolutely open about their practice, and they're totally willing to make changes in order to provide better service. Now think about this for a second. If you had a health need, right, where would you want to be treated, and by which type of doctors? Would you want to be in McAllen, right? Or would you want to be with a doctor in the network of the Mayo Clinic, right? I don't think I have to answer that question for you. Now, let's transfer that idea to the work that we do as educators. If you had a child, a grandchild, and they were going to school, and there were 2 options. One school resembled McAllen, Texas. Another school resembled the Mayo Clinic networks. Where would you want your child or your grandchild, right? I think I don't have to answer that question for us, right? So, what we're trying to accomplish at Alta High School is to actually build an accountable care organization with these concepts, these principles that I've just explained to you. What we're trying to do is we're trying to break down the interests of adults, and we're trying to put the needs of kids first. Now, that's not an easy thing to do. We're going about it by saying, look, we we can only take care of kids better by coming together, by learning about each other, by learning about the practices that we have, by rooting out, in the medical industry is poor preventative care. In our case, is rooting out poor tier 1 instruction, right? And the way we go about it, we're trying to do it by saying, look, we got to hang, like the doctors in the Mayo clinics are hanging their coats in the closet and are totally open about their practice. We got to be willing to do the same thing, because it is just as important that a kid learns to read, or in our case, that they learn math, science, what have you, as the guy who's being treated for diabetes, right? So once we are involved in this cycle, we're trying to make sure that when we understand we have failed, which is part of the process, right? Making sure that you know, hey, when you fail, recognize it. The second thing is devise interventions to address that failure, and then you apply that at scale. Now, when we do that, we're truly going to start to see change. And again, it's not an easy thing to do. However, we're moving forward in this direction. A byproduct of this new approach that we're trying to pursue as a high school has been the implementation of an advisory period that we have in our school. About a year and a half ago, as our district was going through reconfiguration, we gathered a group of teachers and we gave them a charge. We said, look, go out and go look at the best practices in high schools in America and figure out what they're doing. Figure out what systems they have in place, what patterns you can identify, and then come back and let's see if we can apply that here at our school. And it was interesting because when that group of teachers went out and they did their homework, they came back and they found characteristics that resembled obviously what was happening at the Mayo Clinic, right? In addition to that, they discovered that a lot of these successful schools had these advisory periods, which really is a safety net for students, and by design it places them with an adult whose main responsibility is to be a caring presence in their lives. I got to tell you, this summer I was walking through the office right before school was started. I was, crazy, busy, and all that good stuff that principals are, and I bumped into this family, and I stopped because you could tell by their physical just appearance that they were anxious, they were a little bit scared. The daughter who was with the parents, tiny little thing, you can tell she was in 9th grade, fragile. And I says, okay, I got to talk to him, see what's going on. And we started to talk, and it was their first experience at a high school, right? And as a principal, I was able to tell the parent, I was able to say, look, not only are all 8 of their teachers really working to get better on a daily basis to prioritize your daughter's education, but you're also going to have a teacher as part of your 8 classes who is designed to look at their grades systemically, to be speaking with them about what's happening in their other classes, and it's going to be a caring presence in your daughter's high school experience. And she's going to have that for 4 years. As we were talking, this parent's countenance just started to change, and they were like, whoa, really? You do that at a high school? And I got to tell you, it was really rewarding for me to be able to say that to them, that our teachers were doing that. And again, small steps, we're still trying to make it work, but it's happening. I want to conclude by just sharing a few insights and what Mr. Landry's experience meant to me. Again, statistically, there is no way I should be standing before you today. However, because of this man, and not just him, but a combination of caring adults, I'm able to do the work that I love to do. This past spring, last year, I walked across the cathedral, the stage of the cathedral, St. John the Divine in the Upper West Side of New York City. The occasion was my graduation from Columbia as a doctoral candidate. I had finished my dissertation and all that. And it was a celebratory day. With me was my mother, who, as I walked across the stage, I got to tell you, it was pretty emotional because I thought about the sacrifice that she made, the sacrifice that my dad made, and just my own challenges, going through school, navigating, immigrating to the U.S., and for me to have had that experience, it was rather, it was very rewarding, but at the same time, it it reminded me of why I'm doing the work that I'm doing as a high school principal. I'm fusing my story, the story of Alta High School, the story of accountable care organizations, the story of Biggs High School. There's Little Biggs, that's the entrance to the city with my 4 kids. I'm fusing these stories to leave one message with you, and that is that high schools, comprehensive high schools, can and should be caring places. And they should be systematic about it. They can and should be one of the most fundamental pieces in our children's education. And they can and should be the gate between adolescence and a successful adult life. Thank you for your time. I appreciated being with you today.